Our next contributor is on Seanad Niall O'Donnell.
Rwy'n alas Caherly agus Crumfalcha Rivenire or Dusbara Treslium Lesson Major Villa and Seanad Clifford Lee agus Conway Dagala Stratis Commerce Trivan Nagiliga agus Trivan Briel Comway. Minister, thank you and I welcome you to the House for this very important debate and statements this afternoon. Unsurprisingly, Minister, and I just want to start by making these few points before I get to the substantive part of my remarks. Unsurprisingly, I'm sure, to Senator Crockwell, I disagree with him in relation to this. And I don't quite understand the psychology or the politics or even the effectiveness of suggesting boots on the border to deal with this. I don't think it's helpful. I actually think it's inflammatory and it causes worry and concern in an already uncertain time for people. So what we need to do is actually work to give practical effect to the Memorandum of Understanding that was agreed between both CMOs what seems like a lifetime ago now. We need to work on the basis that Ireland, and I don't say this, it isn't political to be glib or to be cliched or lazy about this. It isn't political because it's science. Ireland is one epidemiological unit. We all share this big lump of rock, and that is the reality. So when I was travelling down here before Christmas and you were crossing the border towards the Carrickdale Hotel, you were being asked to divert off, and there was a guarded checkpoint there. That was no big deal. That was right and proper. And that is what was replicated across this state and indeed in the north as well. That's how you deal with this. I mean, we've spent months, actually years, talking about the fact that no one wanted a return to a hard border, that you couldn't police the border, that it was absolutely, and nobody knows it better than colleagues from border constituencies, that you would be absolutely wasting your time and wasting Garda and other resources to plant them in particular roads. So I don't think that's a helpful contribution. I know that's not what Senator Martin was suggesting in his remarks, but I just don't think it's helpful in the first instance for that very reason, but also because I just don't think there's any point in arguing for that. We need to not operate in silos. Our health departments need not to be turning their faces away from each other. We need to be sharing information. We need to be coordinating cohesive all-Ireland communication strategies that speak to people, that reassure people, and that give effect to what are meant to be our shared plans to dealing with the emergency that we are all collectively facing, no matter where we are. So that's where our focus should be if we're talking about a north-south response to this, not on very reactionary reflexes towards putting people on the border. Minister, the people of Ireland are facing into the worst phase, potentially, of this pandemic so far. Case numbers have been in their thousands compared to a few months ago. We now have the fastest growing crisis in the world in this state, and the government still hasn't got testing and tracing right. Testing and tracing wasn't used effectively to hunt down the virus. Still no enforcement of mandatory quarantine for people coming into the state, and the all-Ireland response to fighting the virus still isn't right. I imagine this bleak lead into this debate about the rollout of the vaccine to ensure the government approaches its inoculation plans with much more rigour and certitude than it has in its handling of the transmission of the virus. There was a huge sigh of relief across this country when the respective states began the vaccination programmes. People are keen to be vaccinated, keen to play their part in eliminating this virus, not just living with it. The government needs to seize this moment of popular expectation and hope that has arrived with the vaccine. Yet the early signs aren't good that the government and its numerous systems are match ready, to borrow a phrase, for the challenge and the opportunity the inoculation plan offers them and the people of Ireland. The government need to harness the resources that this state has and incorporate them into its vaccination plans. And as it rolls out its plan, it needs to do so in conjunction, as I've said, Minister, with the Northern Executive and its plans. And both administrations need to be joined at the hip, so to speak, to protect and vaccinate the people of this country, no matter where they happen to reside. The more people are vaccinated, the safer the hospitals become on the wards and in the ICUs. The more people are vaccinated, the safer the rest of the population is as they await their job. And I caveat that remark by saying that just because you have the vaccine doesn't mean you can't transmit it. So people, even once they do have the vaccine, should still be careful around those who don't. And it's of crucial importance that the government is instilling confidence in the public as it follows through with its mass vaccination programme. And that confidence will come from information which reflects the government being on top of that plan. A lack of information from the government on this most important of projects will create a vacuum. And into this vacuum will step misinformation and rumour, some of it deliberate, as other colleagues have said. So this is, and I don't doubt it for 1 minute, this is, Minister, a massive undertaking, the biggest in the history of this state. So what are the government's key objectives, and what is its pathway to achieving these objectives? Trained people are essential to the success of the programme. The government has correctly set an ambitious target of 700,000 people to be vaccinated by the end of March. But how did the government arrive at that figure? And set against this figure is the information that the Minister has given us today regarding the reductions and delays in delivery of some of the vaccines, and that others won't be able to meet their delivery commitments. So if there's a shortfall, and it seems there is, in numbers or a shortage of serum, is the government in a position to speedily ensure no one will miss out on being vaccinated in a safe and a timely manner? Does it have the personnel trained to achieve this target? Does it have the required dosage of serum to meet its March target? Does it have the IT system in place to record and register and ultimately guide this unprecedented operation? Has it identified the mass vaccination centres yet? And what of the staff and expertise needed to run these centres? There is also a concern about the accuracy of the designation of people to be vaccinated, from those most vulnerable to those most needed to protect the most vulnerable in residential care homes, in hospitals, on the wards, in the ICUs, in childcare centres, in pharmacies and in GP surgeries. Is the government satisfied, Minister, that the vaccination programme it's overseeing is capable of successfully covering all the various categories of people? Colleagues are telling me that elected representatives are understandably being lobbied about the timeline of vaccination programme, and that when they write to the relevant ministers seeking answers and reassurance for constituents, there is an unacceptable delay in response. And look, I appreciate and understand that this is a significant time and a busy time, but elected representatives, regardless of what level they're at, need to be responded to. They need to get the information in order, as we have all said, that we can have a proper and assist in a proper and comprehensive communication strategy. So people are genuinely worried with the speed that the government is vaccinating is at this point too slow, Minister. And I think it's fair to say that there has been a collective effort from the members of the Oireachtas to support the government in its plans to deal with the consequences of the virus for people on many fronts. But they also need to listen and respond, and indeed change its strategy accordingly when it's necessary. So we want to see this virus extinguished, not just contained. The measures the government has taken across the board, including and particularly the rollout of the vaccination plan, will be judged on whether we are moving towards extinction or containment. And Minister, if you and the Lasca Hirlock will indulge me for just 1 minute, I just want to make the point, separate to this, Minister, while I have you, because we do have a reduction in sittings here of the Seanad for understandable reasons. But we referred previously, and indeed at the order of business this morning, to the upsurge in domestic violence incidents taking place as people are isolating at home. There is a scheme that I want to flag up through pharmacy outlets, where people can quietly seek assistance by asking some of the trained staff there, who will provide them with the ability to contact the Gardaí. That has been rolled out amongst pharmacies here in the south for some months now. Boots chemists in the north have recently announced their Ask for Annie initiative. So if someone asks a member of staff for Annie, then they will bring them to a private space where they can contact the Gardaí. I think at this point we need to look at building on that initiative, encouraging more pharmacies to roll out similar programme, and indeed other trusted places where people can engage. I've written to the Minister, both Minister for Justice and Health, so I'm not trying to catch you on the hop. No. I just wanted to reaffirm that ask here this afternoon.
Thank you very much. No. Yeah, given the gravity, we did want to indulge that. So, Senator Flynn, please.